Hello, ladies and gentlemen. Thank you very much for your patience, and we'll begin this webinar now on how to treat your liver, your blood, and your gallbladder. It's a very important system in Ayurveda. In fact, in Ayurveda, this liver, blood, gallbladder is considered one complete system. So that's why I presented it in this manner. And of course, that would technically include the spleen as well. So the spleen is making the white blood cells, red blood cells. The liver's filtering out the blood, purifying it, managing fat levels, managing hormone levels, and taking out excess toxins, excess saturated fat, and managing it. So the liver has, of course, multiple functions. But in this case, we're talking about its ability to purify the blood and maintain the certain levels of lipids in the blood. And then, of course, the blood itself. The blood itself is innate. It's not an organ per se, so it's not responsible for anything in its own right. It can have inflammation, and of course, it could be blockage. But it's usually the issues are, it's usually a symptom of a different problem when you have a problem with your blood. For example, say we have high cholesterol, or then, you know, the blood didn't make this cholesterol. It has to go back to the liver. The liver's job is to manage fat levels in the blood. So unless you had an excess amount of fat in your diet, if you live in Texas and you have fried bacon for breakfast and hamburger for dinner and a barbecue steak for lunch, then, you know, this would be excess saturated fat in your diet. Your liver would not be able to deal with that excess amount of fat. The liver would become fatty, and then your cholesterol levels would go up. But if you were on, say, a vegetarian diet, and you weren't having a lot of dairy, not to say dairy is bad or anything, but moderate amounts of dairy, and not a lot of fried foods that could also increase congestion in the liver, then and your cholesterol went up, or triglycerides, or unhealthy fat, low density lipoproteins, LDL, then that would mean that you're having trouble with the liver itself, that the liver is not able to break down the fats properly and fatty acids with the bile, and then you would have a issue with higher fat levels in your blood. So that's why the blood and the liver are together, because if there's a problem with the liver, it's going to show up in the blood. Of course, the same could be said for the spleen. If you were high or low in platelets or red blood cells, this could be partially traced to spleen. But we're going to focus today on gallbladder, which is a small little sac, we could say, underneath the liver that holds the bile. So it's kind of not an active organ by itself, but more of a supporting organ of the liver, holding the bile, which is made by the liver. And this bile comes out, you know, to emulsify and digest fat that we consume in our diet. So the typical health problems that people have are fatty liver, which creates high cholesterol, unhealthy fat in the blood. Of course, this can lead to blockages in the arteries and lead to serious health problems such as stroke, heart attack, and also gallbladder congestion. Gallbladder can easily become clogged and congested. The bile becomes too thick and is unable to move freely from the gallbladder through the gallbladder duct into the upper part of the small intestines. And then you have a blockage, then you have a gallbladder attack, where the bile's trying to come out, but it's not able to because the bile's become hard, and we could call it gallstones. That's basically hardened bile. And then you have a gallbladder attack. So this is a second main issue that we can have with this system, is the gallbladder itself becomes blocked. And this often goes hand in hand with the fatty liver, the high cholesterol, the gallbladder attack. In fact, all of these conditions in Ayurveda are related to blockage, kapha, which means excess fat in the diet, unprocessed, undigested fat, saturated fats, but hydrogenated oils as well, being so close to plastic in their chemical composition, also tend to be undigestible by the system. That's why fast food will bring on many of these problems that we're talking about here, because we know all fast food establishments are using these type of hydrogenated oils, hydrogenated fats, and they're basically undigestible for the body. So this is leading to this fatty liver, gallbladder congestion, and ultimately cholesterol or even gallbladder attacks. So we want to really avoid this. And this type of, there's two treatments in this. One would be preventive, which would be taking some of these herbs to kind of thin the bile, improve the liver function, and which would ultimately lower and manage blood fat levels better in the body, in the blood. And the other, of course, would be to treat a more acute condition where a person was having a gallbladder attack. So we're not going to talk about that so much. It's going to be more talking about managing the cholesterol levels and improving liver function, and cleaning out the gallbladder to avoid a future gallbladder attack. And this is very important. Of course, we could have other conditions to the liver. We can't, this is only one category of conditions. The other category of health problems related to liver, in Ayurveda, we'd call them vata related, which would mean more like cirrhosis of the liver. Parts of the liver are actually dying and not regenerating themselves. So this is another type of condition, completely the opposite. And many of these herbs that I'm going to talk about today can help with regenerating liver cells. And the liver, of course, is unlike, say, other organs in the body, particularly the kidneys, which is much harder for it to recover and regenerate. The liver does regenerate itself. So, and then the third category would be inflammation in the liver. And this usually is, we could call like a virus. Hepatitis would be in this category. Any type of viral infection that is present in the liver is then going to create type of inflammation and toxicity in the liver. And in Ayurveda, this would be a pitta condition. So, you know, it's a tridoshic system, Ayurveda. So we can look at the liver and diagnose it in these three major categories. One, is it clogged and congested and fatty, kapha, which is most common in our society of fried foods, fast foods, excess fat? Or is it depleted and weak and dying through a type of and even shrinking and becoming hard? And then this also is decreasing its ability to function. And then the bile becomes thick and it clogs too. So both the kind of fatty, kapha orientated condition will clog the liver, but also this dry, depleted, dying type of liver also will eventually clog the gallbladder and the liver and decrease its function. And then the third category is when it's infected. And that, of course, is the trickiest of the three, because you have to fight the infection, the viral infection, while at the same time supporting the liver to allow it to recover from having this damage related by the viral infection. So just like with any condition, if we look at the system in our body, we're talking about the liver, the blood, the gallbladder, and somewhat the spleen. Is this one system, just like a car mechanic would look at your water system, your heating system, your electrical system, your cooling system, your fuel system. Well, the body is made up of a lot of different systems as well. So we're looking at this system, and this system should be something that we all should take note in, you know, in our body, and diagnose its condition and determine whether it's in one of these three categories. Is it too congested, fatty, doctor probably can see some high cholesterol coming up. Maybe you have some swelling in the liver, and you can get like the little beer belly from this type of swollen liver. Or is it painful and inflamed? You can just, under your right rib, you can just put your hands under your right rib and just kind of press in there under your right rib. And if you don't have too much body fat, of course. If you got a lot of body fat, you really have to press quite hard. But if you don't have too much body fat, you can, under your right rib, you can bend over and press in there and feel your liver. You know, you get past a little bit of fat, or if you're very thin, you don't have much fat, you can feel it right away. And then you should feel the condition of your liver. If it's tender, then this is a type of mild type of inflammation in the liver. It's painful. If it's hard as a rock, then this is a mild type of, we don't want to say cirrhosis of the liver, but it's, in Ayurveda, we call it kind of a depleted liver, or vata in the liver. It becomes hard, and you can feel it. It's hard as a rock in some people. And then other people, it's large and swollen. So you really have to diagnose the state of your liver before you start doing a liver cleanse or liver treatment or liver or gallbladder treatment. You have to know which of these three categories you're in. Of course, today we're going to focus mostly on the main category of clogged gallbladder, fatty liver, high cholesterol, because this is where the majority of people are. But these herbs, with some variation, other herbs combined with them, still can support all these conditions. So let's just talk about some herbs here. And being the best herb for all liver conditions is, any guesses there? I'm going to shoot some text back. Any text? Dandelion. Dandelion root, that's right. This is probably by far the best liver herb there is in Western herbalism. Of course, you know, Chinese use dandelion too. Ayurveda doesn't use dandelion per se, but they have other herbs that are similar. Sometimes we compare an Indian herb is similar to a Western herb. But in Western herbology, and even in Chinese, dandelion root. And you can also have the leaf. The leaf is a little better for the kidneys, but also helpful for the liver. And what dandelion does, it decongests the liver, supports the liver, helps the liver to build more cells, and in a sense, it's detoxing it, cleansing it, and reducing down fat levels. Now, when we make a tea, we don't just put dandelion in it, even though that would be the main ingredient. Next, we would combine it with burdock root. I don't have a loose bag of burdock root, but I do have a bag of liver tea here, so you can get a little idea. Those little round circles there, that's coriander. And coriander is very cooling because the liver is, in Ayurveda, it's a pitta, it's a hot organ. If you ever feel your blood when it comes out, it's a little warm. And a lot of times when people have rashes and pimples and skin problems, you can feel the heat of the blood. So the blood can get hot very easily. And the liver can get tender and sensitive, hot. So coriander is a very cooling herb. So we put coriander in there to cool it. We don't want too much ginger because the ginger is a very heating herb. So we balance it with a dandelion, burdock. These are the main two herbs for sure. Burdock root is more supportive. It's not as potent as dandelion, and more supportive of building liver tissue. And dandelion is very cooling. It's very cooling and slightly sweet and slightly bitter. So when you drink it, it's got a bitter taste, but also a slightly sweet taste. It's very tasty. And you can roast dandelion, and of course, it's not as good therapeutically roasted, but still it has a very pleasant taste to it. And then we combine this with the seed. The seed is milk thistle. And a lot of people are taking some of these herbs like milk thistle and tinctures for their liver. This is not correct because, one, the liver doesn't like any form of alcohol. We know this. It destroys brain cells and liver cells, so it's a well-known fact. So why would we be taking a herb for the liver and alcohol substance. It's not suitable. And besides, when you take a tincture and you put it on your mouth or under your tongue, it's rushing into the bloodstream right around that area very quickly. And that's not what we want when we take an herb for the liver. We want to go into the liver. We don't want to go into our mouth. We don't want to go in straight into the bloodstream at this point. We want to go in through the digestive system. So taking tinctures for the liver is not correct. That's not the right carrier, because you got to have the right herb, and then you also have the right carrier, the vehicle to get it to the right place. And tincture is not correct. So milk thistle is the third most important ingredient in my liver tea, which is what we're talking about. And milk thistle is particularly good in increasing the bile and thinning out the bile, not so much supporting the liver. People think milk thistle supports liver function or regenerates the liver, but no, it's mostly the dandelion and the burdock. The milk thistle helps to thin the bile and get the bile out of the gallbladder. So it's very good for gallbladder congestion. And then we put in a little bit of licorice. Licorice is kind of like the catalyst. It kind of brings all these herbs together and makes them work a little bit better. And it's also got that sweet taste. And the liver likes that sweet and bitter taste. These are the tastes. So you notice all liver herbs are bitter. And the more bitter they are, the more powerful they are. So the Indian herbs, like kukti, brinjal, shankpushpi, you notice these are very bitter. And that's why they're more powerful than dandelion, because of bitterness. In the old days, they used to have bitters before they ate a meal. You know, if you were a king and you were about ready to eat your entire duck, you know, it was a lot of fat, not easy to digest for the liver, and they knew it. So they would have a little bitter before the meal, and this would stimulate the liver into working better so they could eat the whole duck. So this tradition of having bitters before meals went on for a long time and is still common in some cultures. So that's why these herbs are generally given at the beginning of the meal. So not in a tincture, not in the middle of the night, not even so much in a cup of tea between meals, but before you eat, to stimulate the liver into action, so it's been able to digest the fat much better. So let's take a look here at the formula. And there's the formula. I'll hide around the corner. See, it says improves bile flow, detoxifies the liver. There we go. Now it focused in. Organic ingredients: dandelion, burdock, milk thistle, licorice root, coriander, and a little ginger. And a little ginger. But when you have it, you don't feel the ginger. It's just a little bit in there because we don't want to make it too hot. The ginger just is there to kind of like a catalyst. You know, we're using ginger and licorice to kind of bring all the herbs together and to make them more effective. So this tea is best before meals. It's very stimulating. Sometimes I give this tea out to people and they drink it at night and they're unable to go to sleep. Why? There's no stimulants in it. There's no caffeine in it. There's nothing that should keep them awake. But once you stimulate the liver, you know, all metabolic actions will increase. You know, hormonal production will increase, liver functions will improve, digestion will improve, appetite will increase. So, you know, you don't want to take these liver stimulating, liver supporting herbs at night. So best right before you eat. That's the best time. Little liver tea, dandelion tea with the meal right before you eat the meal. Then the liver will be functioning better when you actually have the meal. So if we go to Indian herbs, the Indian herbs are mostly in powders, not so much in teas. So we have one here. It's called Ayurvedic liver formula. There we go. And this one is for Vata. So I have them broken down into 3 categories, like I talked about earlier. This one is going to be for somebody who's thin, cold, dry, and the liver's hard and not working well, and the bile's, you know, not coming out well, and they're having a lot of trouble digesting fat. In fact, you can tell if you have liver problems because you're going to have trouble digesting fat. the most common thing that people say is, oh, I just can't have fried foods. I just can't have oily foods. You know, so then they just stop eating all oily foods and fried foods. So, you know, this just means your liver's not working well. Because like I say to people, you know, the human body was made to be able to digest bread. So if you can't digest bread, you have a problem with your digestive system. Doesn't matter if it's good bread, bad bread, high gluten bread, whole wheat bread, your body should be able to eat a slice of pizza. Not to say it's good for you to eat pizza every day, but your body should be able to do it. Look at your kids, they're eating it. That's because their digestive system isn't ruined yet. It's still young. It's like a new car, just out of the shop, you know, it's still working good. So they can eat pizza. They're not talking about heavy, complaining, gas, bloating. And, you know, all the organs and parts are new. Now, same with fat. If you can't have oily food, fried food, it's not, leaving out oil and fried food isn't your solution, because once you leave out all oil, all fat, all dairy, then you're going to just dry out your entire body by not having enough fat, because we know that every cell membrane in the body is surrounded by fat, and your skin and your fat's lubricating all your joints. So if you leave out fat, you know, your joint's going to become cracky, and this is going to lead to arthritic pain. The brain, we know, requires a lot of fat. It's white matter in the brain. So then you have cognitive problems and dementia. In fact, a lot of the dementia cases are due to extremely long use of low-fat diet. When we get the people in who are at 70, 80 years old and they have dementia or Alzheimer's or type of cognitive problem where their memory's not working, then I always ask them, you on a low-fat diet? And they go, oh, yes, 45 years. All we've been having low-fat milk. So, in effect, skin's dry, lips are dry, stool is dry, you know, they're dry. And we can assume, we know, when the body's dry and they just keep putting lotion on the outside, there's not enough oil on the body. So it becomes dry. So just putting oil on the outside, you know, doesn't really solve the inner problems, because inside the body, it needs this type of fat for most metabolic activities. To make more hormones, we need fat. And so we can even have hormonal imbalances by not having enough fat in the diet. And this is very common. People do this zero fat diet or no fat diet. And the real reason is because they're doing it is because they can't digest it anymore in most cases, or they just read it on Facebook somewhere not to have any fat and they would lose weight. But that's a false understanding. So you have to have a certain amount of fat every day in your diet. It's not a matter of fat being bad or good. It's a matter of what kind of fat are we talking about? Is this healthy fat like olive oil, sunflower oil, sesame seed oil, ghee, or unhealthy fat like fried oils, hydrogenated oils, trans fats, which are undigestible, and we can find these in fried foods. So those fats are all going to be difficult on the liver, eventually create blockages in the liver. And once you have blockages in the liver, you can have become more lethargic. You're going to have more difficulty digesting fats, digesting oils. And then, of course, people's reaction is just to stop it all. So it's better to clean out the liver, clean out the gallbladder, get the gallbladder moving, and then you can have your daily requirements of fat in your diet, which is for at least 3 teaspoons to up to 3 tablespoons per day per person, requires this much fat. So if you're living on a no-fat diet, then it's only a matter of time you're going to start to have a lot of health problems. You can go for a short period of time because the liver actually is storing fat, so it's managing it. So you can go for a little while without fat. Another thing I want to mention is that there are ways to just flush out the gallbladder. And many people are aware of these because many naturopaths like Andres Moritz copied these Indian methods of cleaning out the gallbladder. And one of them is you have in the early morning, you have lemon mixed with olive oil first thing in the morning. And this is many variations on this, depending on the individual. But basically, the day before, you don't have any fat in the diet, no fat, no oil for the diet. Even you could go 1 or 2 days, 3 days, depending on the individual, just eating like rice and grains and steamed vegetables and soup with no fat, no avocado. And then on maybe the 3rd day, you know, you have this 1/4 cup of olive oil with a couple lemons squeezed in it, mixed up first thing in the morning. And this will flush out the gallbladder, makes the gallbladder contract and flush out. And generally, and the gallstones can come right out in the toilet. Now, of course, you have to make sure you're having good bowel movements. I haven't brought that up, but it's a very important point because we know that the liver, being a detoxifying organ, is collecting the bile, which is partially toxins, but it has another purpose as well. It's emulsifying the fat when we digest this bile, but it's also got toxins in it because the body knows that it's going to come out with the stool. So the liver doesn't have its own doorway out of the body like other eliminating organs, like the lungs, we can exhale, the skin is an eliminating organ, and it can sweat it off, and the urinary system can get out the toxins, and colon can get out the toxins. But the liver has to go out with the fecal matter. So if you're constipated, you can't do a liver cleanse, because then if you start cleansing the liver and stimulating it, more bile's coming out, but you're not having 2 or 3 bowel movements a day, then this bile actually isn't removed quick enough from the body. So we get what's called little autotoxicity. And this is very common when you hear about people doing cleanses at home where they get headaches, rashes. That's all the signs of autotoxicity. They're detoxing too fast, and they're not eliminating it quick enough from the body. And headache is probably the most common symptom of this. They call it healing crisis, but it's really just a incorrectly done detoxification where they're not generally eliminating the toxins fast enough. So if you just start drinking a lot of dandelion tea and just, or my formula, or you just go to the backyard and dig up some dandelion and chop it all up, leaves and roots, and start drinking it all day long, but you're constipated, or even just going 1 time a day, then you could create like a little mini healing crisis where the liver starts working and filtering out the blood and getting the bile moving, and the bile's coming out into the upper small intestines there, but you're not getting it out of the body. And then you feel terrible, you feel nauseated, you feel headaches, and feel tired and weak. So it's very important to really almost clean the colon first. And we're going to do this spring cleanse every year with a workshop, which we're doing this Sunday. And we always make sure that the people start the colon herbs first. Just start the colon herbs first for a good week in advance. Make sure the bowels are moving, not just 1 a day. 1 time a day is still constipated. Unless you're just having 1 meal a day, then okay, that's fine. But if you're having 2, 3 meals a day, then you should have 2, 3 bowel movements a day. So, and if you're going to clean out the liver first, you probably want to up that to 3 or 4 bowel movements a day and really make sure it's moving. And do this for a good week first. You start drinking your dandelion tea or your liver herbs to improve your liver function, because you have to have some way for the liver to get out. Also, sweating helps a lot too. So, you know, sauna, sweats, hot baths. You also taking hot baths during these liver cleanses can help a lot, because then the salt bath is extracting through your skin. So that can help. Getting the bowels moving, making sure the body's sweating. If you're not sweating and you're dry all the time, then you could say you're clogged. Your skin is clogged. You're going to have skin problems, bumps, rashes, because your body is meant to sweat. And when you're not sweating, then you're not detoxifying through this major eliminating organ, the skin. And this creates another burden for the other eliminating organs like the liver. So we generally want to get the bowels moving, get the person sweating, so a little exercise, hot bath, something to get the things moving and get the body sweating to eliminate these toxins as much as we can before this type of cleanse. So you can start by doing these liver cleanse after you get the bowels going, and you can go for a couple weeks. You can go slow and steady if you don't have any health problems. You can do like couple bags of this liver tea every spring. Spring is the best time. You also have timing is also very important. You don't want to be cleansing the liver in the winter time per se. This is a time where we actually want to eat more fatty foods, more oily foods to make our skin thicker so we don't get too cold in the winter and we have a little storage. That's why we always put on a little weight during the winter time, because winter is not the time to lose weight. Winter is a time to gain a little weight. It's all right that the body should gain a little weight during the winter, and spring should start to lose it. So now's the time to lose the weight. Many people say, oh, winter long, I wasn't losing any weight anyway. Well, you're going against the stream. You know, you're going to making things difficult when you try to lose weight during the wintertime when the body is more happy to put on weight. But now is the time to start to lose the summer fat. I mean, the winter fat, which we got from the cheesecakes and the Thanksgiving dinner and the New Year's parties and all these things, and the cold weather makes you want to eat more. So we probably did. And it felt good to have oily food during that period. And I started mentioning earlier, and I just want to reemphasize this, some of the symptoms of this type of clogged, congested, or poor functioning liver. One, you probably have an aversion to having fatty foods and oily foods, so you just stop them. But that doesn't fix your liver. But other signs are feeling nauseated, feeling like you could throw up, like, oh God, I shouldn't have had that fried French fries. And you don't really throw up, but you feel that nauseated feeling. And of course, if you start to get pain right under the right rib cage there a little bit, after something oily or fried, then, that's probably the gallbladder trying to get out the bile. Because the liver is not going to really feel that painful. It's just going to, when it's not working well, people can feel discomfort, nauseated, and they say it's a feeling of like you want to throw up, but you don't. And that's generally the sign the liver isn't able to digest the fatty food that you just had, and now you get that nauseated type of feeling. And if you get a sharp pain after you had that T-bone steak, 9 o'clock at night, and it's right there, sometimes people think it's a heart attack because it's so painful. And often these gallbladder attacks mostly are happening in the evening, eating late at night, having that steak dinner at night, or some fried potato chips at midnight, and this type of fat is likely to trigger a gallbladder, because fat per se isn't going into the liver, but the fat's coming from the stomach, and then it's coming into the upper small intestines, and then when the body knows there's that much fat, it has to squirt out the bile, because bile is like an emulsifier. It liquefies the fat, helps it break down into fatty acids. So when there's a lot of fat, then there's a lot of bile want to come out. But there's a lot of fat that the bile doesn't come out, then that's when you get the pain right there. See? Because the bile's not able to get out because you have a clogged gallbladder. And of course, many people are rushed off to the hospital at this point because it's very painful, and often people accompanying them think that they're having a heart attack. But when they get to the hospital tells them that you're having a gallbladder attack, and they just remove it, give it back to you in a little jar, and send you a bill for, I heard it's about $25,000, but insurance will cover it. But now you have another problem. Now you're handicapped for the rest of your life because you have no gallbladder. And for those people who have had their gallbladder removed, they know very clearly why you have a gallbladder. And that is to hold that bile. And once you don't have that gallbladder, you'll even have kind of continual lifetime problems of digesting fat and fatty foods because of the no gallbladder. And if you have had gallbladder attacks and you're watching this webinar and you're trying to avoid the next one, which is usually a great motivator. I get a lot of clients who just had a gallbladder attack, never called me before. They could have been my neighbor, known me for 10 years, and who cares? But the day they get the gallbladder attack, it's very painful, and they don't want another one. And that generally will motivate them to want to do something or talk to me, even though, of course, they've probably waited, I don't want to say too long, but they waited till the end. It's better to be preventive than it is to wait for these painful conditions that force you to take action. I always say that pain is your friend. I know it's hard to take when you have a lot of pain, but it is your friend, because if pain is telling you a very simple message, we got a damn big problem here, and you better stop whatever else you're doing and deal with it. And that's the message. I've just kind of translated it for you. So you got the point. And if you just take a painkiller, whether it's joint pain, muscle pain, headache, then it's like just turning the alarm system off. So that's why it's very dangerous to go down that slippery path of taking painkillers and not dealing with the cause of the pain. And this is true for headaches, arthritic pain, nerve pain, and definitely gallbladder pain, even though the painkillers in this case for sure won't help you, because you could easily get a gallbladder attack again. So taking a painkiller isn't going to help you one little bit. And even for arthritis, I mean, you're better off to deal with it. Many people have painful conditions like muscle pain and joint pain. I don't give them any herbs, analgesic herbs for the pain. I tell them the pain is the measurement that we have of the progress. So if you have muscle pain, or some people call it fibromyalgia, or joint pain, some people call this arthritis, rheumatoid arthritis, but we can call it what it is from layman's point of view: muscle pain, joint inflammation, muscle inflammation. Then when you start to do the treatment, change the diet, take the herbs, you'll start to see the inflammation and pain is reducing. So when you come back after 1 month of following the diet, anti-inflammatory diet, specific diet for you individually, and you have less pain, we can know that you've been making progress. You have 50% less pain, so you're 50% done. So this is why pain is so important to not deny, but to deal with. It means you need to stop other things in your life and deal with it. So really the alarm system going off, and a headache is like the main alarm system going off. So you want to take these very seriously and try to determine the causes and remove the causes, and then treat the body accordingly. And there could be 100 reasons for a headache. So, you know, I don't want to get off subject here, but think of pain as your friend. At least it's making you deal with it, making you come to me, making you take the herbs, and making you improve your health. That's what pain's doing. So same with gallbladder. It's making you say, hey, maybe you can't be eating these T-bone steaks with the fried French fries at midnight anymore. You need to back off. Maybe consider even become vegetarian. In fact, most people with high cholesterol or high triglycerides, now we got the good fat and the bad fat, or the low density lipoproteins, then it's the best thing they could ever do is just become vegetarian, because vegetarian diet, you can now control the fat. You can now add to your meal just enough fat so you can get by. And if you're having gallbladder problems and you're watching this, then you know you still want to have some fat. You just want to there's no dog in the yard there or anything? Sorry about that, Will. Can you go see? So if you're having gallbladder problems, you really don't want to eliminate all fat, and you want to clean out the gallbladder. You can do some gallbladder flushes. You can start doing the gallbladder herbs, liver herbs. I have special herbs just for the gallbladder too, to clean out the gallbladder, but I'm using all Indian herbs. And there's even an Indian treatment, Virtana. It's called Virtana, and it's basically, it looks like you're having diarrhea, but what it is it's flushing out from the gallbladder all the way down. So there's certain herbs that you take, and you take these, you know, in the early evening and after a meal, and then you get, like a couple hours later, you get diarrhea, and it's flushing out the gallstones, flushing out the whole colon, all in one shot. So Ayurveda already has this type of herbs and herbal formulas to flush out the gallbladder. So it's almost easier to use Indian herbs than Western herbs, because they already have the formulas already made for these particular jobs. But as I was saying, you want to have at least some fat during this period, like avocado oil is easy to digest, and sunflower oil. Most people with fatty liver problems, gallbladder problems, I put them on sunflower oil. because it's a very thin oil. If you look at it in the bottle, it's like, looks like water. And you definitely don't want to be doing coconut oil. I know that there's research out there, and but it's kind of it's good for the liver. But in Ayurveda, it's very heavy, saturated fat, which is a big burden for the liver. And if anybody's had a gallbladder attack, they know that coconut oil is not helping. People have told me who've had repeated gallbladder attacks, I mean, multiple gallbladder attacks, have told me that they had 1 teaspoon of coconut oil, they had another attack. But they could have a tablespoon or 2 of sunflower oil and no attack, no problem. Avocado oil also has that effect, even though it's more expensive. So you need a very thin, very light oil. Ayurveda looks at things from this point of view, not so much of the molecular structure, or whether it's saturated or not, but its actual taste and its effect on the body. And Ayurveda is very clear that sunflower oil is the easiest on the liver. We don't really care about the omega-6s and omega-3s when you're having gallbladder attacks. So sunflower oil, small amounts, and then doing the liver herbs for a good 2 or 3 weeks, and then doing the gallbladder flush if you've had problems in the past with the gallbladder. So just a review real quick, and we'll wind it up. So every spring, you should try to do a liver and gallbladder cleanse. You can first go on a somewhat low-fat diet, vegetarian diet preferred, with very little dairy, just ghee. In fact, ghee is easy to digest for the liver. People who have gallbladder attacks can do small amounts of ghee as well, and they don't have a problem. But if they do normal butter with animal protein, then they have the adverse effects. So every spring, which is basically now, unless you're in a northern climate, I think you got another month or so to go before it starts to get warm. But here in Southern California, now's the time to start doing these type of cleanses, where we get the bowels moving first, take some herbs to get it going, unless you're having easy 3-4 bowel movements a day, and then start drinking your liver tea or dandelion, burdock root, milk thistle tea. Do that for a couple weeks to strengthen up the liver, and then you can do a little gallbladder flush for a couple days, where it should be adjusted. Some practitioners should adjust it for you individually to make sure you get it right, because obviously a smaller person, a petite person under 100 pounds would be a completely different treatment than a person over 200 pounds. So you must be very careful in reading these off-the-shelf gallbladder cleanses, because the quantities of the herbs, the quantity of the oil used, and the method used, you have to could vary greatly from the individual. A lot of these cleanses take a lot of salt at the end to kind of loosen up the gallstones and create kind of a laxative effect. But if you have a history of high blood pressure, you don't want to be taking 2 teaspoons of salt. So that would only be suitable for certain people. So it's better to have that gallbladder flush kind of adjusted for you individually and not be doing it on your own. But if you've been a vegetarian most of your life, then and you don't have any big issues with your gallbladder, like in my case, I've been a vegetarian most of my life, then I don't really need to do the gallbladder flush. I just do the tea and do the herbs. So we'll wind it up here, because that gives you an idea of the importance of it, because it helps avoid a lot of health problems. But I'll go through a few Indian herbs for those who are interested. One of the most famous Indian herbs is called bhumyamalaki. I don't think you can read it on the screen, but bhumyamalaki is used for all liver conditions: vata, pitta, kapha, cirrhosis of the liver, hepatitis of the liver, all using bhumyamalaki. It's an excellent herb for the liver. A better herb for fatty liver and cholesterol and a clogged liver is an Indian herb called kukti. And kukti is used for all these type of fatty liver cases, cholesterol cases. And then another herb, shankpushpi. Shankpushpi is a very cooling herb that, combined with this bhumyamalaki, for example, and coriander, is very nice to bring the heat and burning down in the liver. So if we have somebody with psoriasis, a skin problem, red rashes, red pimples, red skin, and a tender, painful liver, we're going to not use these heating herbs. We're going to use these cooling herbs like shankpushpi, bhumyamalaki, coriander, to help cleanse the liver, strengthen the liver, and cool it down as well. And then you see the redness go down, the pimples improve. So, these are signs of poor liver function. Pimples, a lot of pimples, rashes, almost all skin problems can relate back to the blood, and blood can always relate back to the liver. So when you have rashes, psoriasis, even allergies, you can generally want to cleanse the liver. A lot of hormonal problems can result because the liver is not functioning well and cannot make the hormones. So I would say that most people with chronic or multiple chronic health problems, high blood pressure, cholesterol, metabolic syndrome, we call it, could use a liver cleanse, because the liver, improving liver function just about helps everybody except for young children who have a new liver, basically. I mean, their liver's only 10 years old, so it's still working fine. 15 years old, still doing good. But, for rest of us who have 50-year-old plus livers, then we could really benefit from these regular liver cleanses. So I just can't emphasize that enough, and how it can help your life. And everybody who's have metabolic disorders, and even weight loss, a lot of times we're treating the liver. People say, well, how come I came to you for weight loss and you gave me the colon herbs, you gave me the liver herbs, you gave me the digestion herbs? And I said, that's because I treated your causes, besides your snacking and eating, pizza at midnight. We have to get rid of the bad habits, the snacking on the nuts during the day, the cookies, the crackers, the protein bars, the cold foods. That's another subject. But often it's the liver becomes congested, the colon becomes congested, and the digestion becomes weak, no appetite, not a strong appetite, but they're eating anyway. So this all contributes to weight gain. So most people with weight gain problems have liver issues, digestion issues, and elimination issues. So I'm not giving you a bottle that says for weight loss. I'm giving you a bottle to improve the liver function, clean out the colon, and strengthen the digestion, and get rid of all your bad habits that are the major cause of your weight gain in the first place. So, I know people I have products that say weight loss tea and weight loss formulas, but I would only give this to them secondary. Once the weight is already starting to come off and the liver function is improving, digestion is strong, and elimination is good, and they're losing weight, then we can give them some weight loss tea, weight loss herbs to kind of expedite the process. But you look at all the weight loss herbs, they all have herbs for liver in there, because they know that the liver is a big factor in losing weight and improving metabolism. Okay, well, we'll stay on here and I'll answer some of your questions in chat, but I'll stop the recording for now. So thank you very much.